Healthcare in America is ironic. We excel in medical interventions, prescribing medications, screening for and treating cancer, and in treating acute injuries, but we struggle greatly with preventable chronic diseases. In fact, one of the most preventable diseases affecting us right now is obesity, the number 2 cause of preventable death in the country, with roughly 2/3 of adults and 1/3 of children now considered to be overweight or obese. It's an epidemic we cannot ignore.
Preventable diseases are slipping through the cracks, and I believe that there are several reasons for this. First, we don't focus our healthcare spending on prevention. Nearly 70% of our deaths in the US are preventable. 3/4 of our healthcare spending is dedicated to treating these conditions, while only about 3% is spent on prevention. Second, we have yet within the healthcare system to create effective, consistent methods to reverse preventable diseases like obesity. And finally, we've engineered physical movement out of our lifestyle and fast food in. It's why most of us don't meet the recommendations for physical activity, for fruit and vegetable intake. Until it's easier to walk, to bike, to go outside, until the healthier choices are the cheaper choices, it will be really difficult to sustain our clinical interventions.
Health experts like Stephanie Van Dyke believe that we can begin to reverse these statistics through weight management programs. Most importantly, if used within the healthcare system, programs like this have the potential to reach millions of people across the U.S.
Effective programs, they must focus on the whole person. They must help build these healthy lifestyle habits, and they must follow the evidence-based behavioral interventions, which show reproducible, consistent success. So that's exactly our mission at the Sky Lakes Wellness Center.
Our food choices are very important to our health, not just in terms of weight loss, but in terms of considering risks for chronic conditions or reducing our risk for chronic conditions. So when somebody's trying to lose weight, we need to really focus on what people are choosing to eat, how much they're selecting to eat, and really be aware of how that is playing into their weight loss journey.
A little less than a year ago, I was 310 pounds, and my wife and I were in the point in the relationship where we wanted to start a family, but I wanted to get healthier so I could be around for that family. So I decided to join a weight management program and get that extra support. And once I did that and I got the right tools, it seemed to just fly right off. So I definitely think that weight management should be offered through our healthcare system, because would an insurance company rather treat a disease for the rest of that person's life or take the right steps to cure that disease and prevent that disease?
If we are going to control our healthcare spending, then effective programs that succeed in helping patients reverse their chronic diseases through weight loss, through lifestyle change, we believe that they're not only practical, but that they must be a part of the equation. We at the Sky Lakes Wellness Center, we've translated the CDC's DPP, an effective lifestyle program that succeeds in helping patients reverse chronic diseases through weight loss. And we've translated this program into a clinical model, and the results that we're seeing are really encouraging.
Sky Lakes Wellness Center is a place of hope, healing, and health. Based in idyllic Klamath Falls, Oregon, the center provides the full spectrum of care for those who are overweight and obese. By closely examining the needs of each individual patient and incorporating group classes, a key for participants' change, the staff at Sky Lakes Wellness Center is dedicated to one thing: getting people healthy again for the long term.
The comprehensive weight loss program that we offer at Sky Lakes Wellness Center is focused on incorporating healthy habits into a lifestyle. It's more than just about learning about nutrition or about physical activity, because our health is so much more than that. Understanding how our surroundings can influence our decisions, how stress and sleep can impact our health, and even how gratitude can actually help us to make behavior changes are very vital components to understand. In addition to the weight loss program, we also offer cooking classes where people can gain confidence in cooking delicious, healthy meals for themselves and their family. These classes aim to empower people, but also teach them how to eat healthy.
This wasn't just a fad diet where you lose weight for 6 months, you go off the diet and you gain it all back. I now have the tools to continue this for the rest of my life and not have to struggle with it. And they're lifetime changes, and they're changes that I can pass on down to my kids and my cousins, and I don't know how to describe it, how different my life would be without this Sky Lakes Wellness program.
It is so inspiring to be a part of every patient's journey. We're seeing statistically significant reductions in weight, waist circumference, blood pressure, and that's really exciting. But what is most meaningful is seeing patients empowered, realizing their very best self. Our hope is to one day pass our weight management program to other hospital systems, other insurers, because to be able to replicate such a program means that we could potentially help the care of that many more people. It means the possibility of making widespread change and potentially seeing a reduction in our nation's obesity statistics, and that would be a dream come true.
To learn more about Sky Lakes Wellness Center, call the number on your screen.